a little bit more. Hello everybody, it's Charlie and welcome back to my channel, or welcome to my channel if you're new. Today I am going to be doing a re-upload of a video I did quite a while ago here on YouTube, and that was how to pass your dental nurse exams. So I thought what I would do for you today is re-upload that video and do it as a kind of more updated version. So let's just get straight on with this video. So I'm going to be talking about 3 different books in this video today, along with a couple of tips which I use myself to help me pass my dental nurse exams. The first book I'm going to talk about is this little baby here. Now, Carol Hollins is the woman you need in your dental life. Now, this one in particular is the 3rd edition because that's the edition we were on when I went to college. I know for a fact there's going to be some updated editions now, so make sure when you buy them you are getting the correct edition for the year that you're doing it. Obviously, it's a lot to learn, but I promise you, once you've passed your exams, you're not even going to need half of it. You just need it for the exam, so you don't have to retain all this information for years to come. Now, what I really love about this book is that it has each of the exam categories in. What categories we had were radiography, so x-rays, medical emergencies, so anything medical related or emergency related in the dental practice, cross-infection and decontamination, and assessment of oral health and treatment planning. Now, that one was actually the hardest one I found. So like I said, this book has those categories in its content. So if you flick to the content, you will see it has each of the units. That's going to be quite hard to show you on camera. Just as an example, here we go. So all the different chapters are different units. Now, your units are going to be reflected on your workbooks. At least that's how it was for me. There are a lot of different units. Don't worry, you're not going to be doing this many exams, but each unit has a different part of the exam. So we'll take chapter 13, for example, which is assessment of oral health and treatment planning. And this includes things like the orthodontic clinical assessment, disease-related changes of the oral tissues, effects of aging on the soft tissues, and things like that. Also got categories such as principles of infection control in the dental environment. Now, although that doesn't specifically say cross-infection and decontamination, you know that that is going to be part of that exam because it's to do with infection control. The same with chapter 3 in this book, which is first aid essentials. Now, that is obviously going to be to do with medical emergencies. Although it doesn't specifically say medical emergencies, you can work it out based on what the unit is. I know there were a lot of units to cover when I was in college, and this book had every single one of those units, so it was a great tool just to go to, see my unit and find what I needed to find. Now, within your workbooks, you're going to get a lot of questions, and you're going to find the answers to these questions in this book. Now, it doesn't necessarily have every single one. There were only a few, and I mean really a few questions that weren't in this book, but you do have to find the answer. It's not as simple as just reading the question in the workbook, going to the page and the answer's right there in front of you. You actually need to read the information because the answer is going to be in the information. So say, for example, you get a question about standard precautions. You will need to go to the correct unit, and you probably will know the unit that you're going to be studying.
I haven't been studying it.
And you will then need to read through the information to find that particular thing. So for example, I found basic principles of infection control. And within that paragraph, I can see the word standard precautions. So I know that's the paragraph I really need to be taking in to find the answer. You can't just do a quick scan. You will really need to read it. But that's actually a good thing because the information will then actually go in. It shouldn't be as simple as seeing a question and finding the answer in a book. Although you do find the answer in a book, you actually have to really look for it and learn along the way. So that's all I'm going to say about this book. I've just realised I don't think I've said the name of it yet. It's the Diploma in Dental Nursing Level 3 by Carol Hollins. Obviously, you will need to be getting the newest edition for you. This is the 3rd edition, but you will need to get the newest edition. Moving on now to the Levisons. Now, once again, this is the 11th edition, so you are going to need to find the correct edition for the year you're doing it in. But the Levisons is is another critical book which is going to see you through your dental exams. When I was in college, we were told it wasn't absolutely essential, but it was useful to have. However, I found it was essential. The Levisons has been going on for years and years and years, and it's the tool that almost every single dental nurse will use to get them through their exams. Now, this book is very, very similar to the other book we just talked about. It hasn't really got that much more information in. It hasn't really got any less information in, but anything you can't find in the Levisons, you'll likely find in the Diploma book, and anything you can't find in the Diploma book, you'll likely find in your Levisons. Now, the contents of this book are set out slightly differently to the other book, so it doesn't have your units on, which means you're actually going to have to go in and specifically find the chapters. Now, what I like about both these books is that they've not only got diagrams on, they also have real pictures, and this was so useful when I was training because it actually gave me a visual to go off. So when I was reading something, if I could see a picture or see a diagram, wherever it is, then I would be able to visualize that when I was doing my exams or when I was doing my workbooks. The Levisons is also the book that I would reread before every single exam on the chapter that I was about to do the exam for. So say you're going to do medical emergencies, I would go into my Levisons and read the chapter on medical emergencies just so that it was fresh in my brain. So I'm moving on now from the Levisons to the final book, which is the Questions and Answers for Dental Nurses book, again by good old Carol here. I've actually done a video using this book. Please go and check it out if you haven't seen it already, because I think that is possibly my favorite video to date. It was really fun to film. This book has got all your questions and answers in. Now, what I like about it is that it doesn't just tell you the answer, it tells you why that answer is the answer, which is so useful to know. You might get a question where you're not sure of the answer straight away, and you have to go by process of elimination and put other things together in your head to make an answer. And if you know why a certain answer is the correct one, that can really help you piece together information. Now, just be aware, these aren't the questions that's going to come up in your exam. They're just examples of questions that have been used or other wordings of questions that will be used. They aren't going to give you the exam questions in this book because everybody will know the answers. So the way these are laid out is that it will ask you the question and then it will give you the multiple choice answers, and this is how the exam is. Now, I'm not going to bore you with reading any of the questions or the answers because they are quite long, and you can find that in my other videos as well. Just so that you guys are aware, the content will take you through different categories. So you've got things like general anatomy and physiology, oral anatomy and physiology, dental pathology and microbiology, and so on and so on. When you go to that section, you will find that it has the questions at first, and then a couple of pages on, it will have the answers. So this is just a really great tool to have because it will allow you to see the type of questions that might come up in an exam. And what you will also find is that a lot of questions, you will never have come across certain words before. So you are going to have to piece together information that you already know to get an answer, and that's something that is absolutely critical when taking your dental nurse exams, is that they're not always going to be questions you've come across. So moving on from books now, I'm just going to share with you a few little tips which really helped me get through my exams. And the first one is ask. Do not be afraid to ask anybody. Ask your college teacher, ask your practice manager or manageress, ask the dentist, ask the hygienist, just ask if you're not sure. Even if you think you know the answer, just double check with them. It's always good to have the correct answer rather than just guessing. So that kind of leads on to tip 2, which sort of is going back to the questions and answers for dental nurses book. It's always handy to know why a specific answer is that answer, rather than just knowing this is the question, this is the answer. You should be knowing why that's the answer, and that really helps to visualize certain things, and also it helps to piece together knowledge if you know why as well. Now, when you're revising, it's always great to have things like post-it notes stuck everywhere. Stick them in the surgery, maybe in a cupboard or something so they're not out in the surgery, or have them on your bedroom door, or just somewhere that you're going to look, because the more you see something, the more it's going to go into your head. So if you've got something stuck on your bedroom door, you're going to see it every single day. day, and that way that information is going to be retained in your brain. Along with this, you can also do things like make videos. Film yourself talking about certain things and just keep rewatching the video, and that way the information is going to go in. And the very last thing I'm going to talk about in this video today is setting a goal for yourself. Now, I know this might seem like something that is a bit not really necessary, but if you have in your head that you want to pass, say, your radiography exam within the first 3 goes, make all the effort you can to actually get there and do that. I think about 3 or 4 goes to pass radiography, and I never set a goal for that. I just thought, do you know what, it's a hard exam, if I don't pass I can just retake it. But what I should have been thinking is, do you know what, it's a hard exam, I'm really going to revise this section and I want to pass within the first 2 goes. The same applies with seeing college through. So if you set a goal that you want to get through college within 9 months, make sure you do the best you can to revise, to learn things so that you can do college in 9 months. I know a lot of courses are longer, but if you're really putting the effort in to learn it within a certain time frame, then you're likely going to pass your exams fairly quickly. Anyway, I think that's all I need to talk about with you guys today. I'm going to stop talking now so your ears can have a bit of a break. If you guys have any questions, pop them in the comment box below and I will make sure to answer them as best as I can. Equally, if you have any video requests you would like me to do, again, just pop it in the comment box below and I will do my best to film, edit and upload those for you. I hope you guys enjoyed this video today. If you did, please give it a thumbs up. Click that subscribe button down below and then click the little bell next to it so you get notified when I next upload, and I will see you guys in my next video. Bye!